Welcome to this explainer. Today we're diving into something that, let's be honest, can be a little uncomfortable to talk about for a lot of guys, but it is absolutely crucial for your overall health. We're going to break down the physiological link between diabetes and erectile function. And honestly, the science here is fascinating, and understanding it is a total game changer for your physical well-being. So, let's kick things off by completely shifting how we look at this. Let's step away from the embarrassment for a second. What if erectile dysfunction isn't just a bedroom problem? What if it's actually a blaring warning siren from your body? We really need to pay attention when our physical systems stop working the way they used to, because our bodies are trying to tell us something important. You know, it's incredibly common to just brush off these early signs, right? You hear things like, oh, just stress, or I'm just getting older, or hey, it only happens sometimes. But listen, if you have diabetes, sweeping these symptoms under the rug is a huge mistake. By ignoring it, you might be totally missing a much deeper, much more dangerous connection to your overall metabolic and heart health. To really wrap our heads around what's going wrong, we first need to look at the mechanics of how a healthy system actually operates. Getting an erection isn't just a simple single action. It's actually a super complex chain reaction. You need healthy blood vessels, perfectly functioning nerves, good blood flow, balanced hormones, and of course, sexual stimulation. Basically, it requires your body's physical plumbing and internal electrical wiring to work together in perfect harmony. When you get aroused, your nervous system tells your blood vessels to relax so blood can rush in. When it all works, it's a beautifully coordinated system. But here's where things start to go off track. We need to understand exactly how elevated blood sugar throws a wrench into this delicate biological machinery. The big connection here heavily revolves around your blood vessels. See, when your blood sugar stays high for a long time, it doesn't just float around harmlessly. It literally damages the blood vessels, which ruins your normal vascular function. And the math here is brutally simple. No adequate blood flow means no adequate erection. The physical damage literally blocks the blood from doing what it needs to do. And this perfectly captures the incredibly frustrating reality for so many men. I want to have sex, but my body just doesn't cooperate. It's tough, right? Because the psychological desire is 100% there. The attraction is there. But because of that vascular damage from diabetes, the physical response just flat out fails. It is a mechanical roadblock, not a lack of interest. But wait, it's not just the blood vessels, the plumbing, that gets damaged. Diabetes can also mess with your internal electrical wiring. Medically, this is called diabetic neuropathy. It's nerve damage that interrupts the signals between your brain, your spinal cord, and your body. So what that means is, even if a guy is fully stimulated, those arousal signals from the brain just get lost in transit and never actually trigger the physical response. Now, let's clear up a really common misconception. A lot of folks immediately blame low testosterone. And sure, a guy with type 2 diabetes might have low T, which totally kills your desire and energy. But, and this is key, he could also have completely normal testosterone, a totally healthy sex drive, and still struggle with vascular erectile dysfunction because of that physical nerve and blood vessel damage we just talked about. They're two completely different pathways, which is why a real medical evaluation is so important. The tricky thing is, this doesn't usually happen overnight. Like the quote says, it's usually a gradual realization something has changed. Maybe it starts as just having trouble staying firm, or you start noticing fewer morning erections. It might just be an occasional hiccup at first, until you eventually realize, wow, there's a persistent pattern happening here. And we absolutely cannot ignore the human element in all of this, because while the root cause is physical, the emotional fallout is massive. This takes a huge psychological toll. Performance anxiety kicks in, that constant voice in your head asking, will I stay hard this time? And that often leads to just avoiding intimacy altogether. It brings up intense embarrassment, worry over whether your partner is still attracted to you, and it can seriously strain a relationship. And here's the absolute worst part. The anxiety itself triggers a stress response that literally constricts your blood vessels, making the physical problem even worse. It turns a treatable vascular issue into a giant psychological and relationship crisis. Which brings us to the most vital, eye-opening revelation of this entire explainer. We're moving out of the bedroom and zooming out to look at your whole body health. Think about this. Penile blood vessels are incredibly small, way smaller than the arteries near your heart. Because they're so tiny, vascular damage almost always shows up there first, way before you get more obvious cardiovascular symptoms. Erectile dysfunction is basically your body's early warning system. It's the canary in the coal mine, screaming at you about dangerous vascular changes before a major heart issue strikes. And outside of just diabetes, look at these other critical factors that cause ED: high blood pressure, high cholesterol, smoking, obesity, extreme stress, and poor sleep. Every single one of these is a massive flag for systemic health issues. This proves exactly why you should never just shrug this off as a normal part of getting older. Your body is practically waving a giant red flag about your cardiovascular and metabolic health. All right, so here is the good news. This is highly treatable, but you have to take that first crucial step. You need to get professionally evaluated. Listen, your doctor is not going to judge you. To them, this is just a systemic mechanical issue. They're going to run clinical tests to check things like your blood glucose, your HbA1c, which is just a 3-month average of your blood sugar, your blood pressure, cholesterol, kidney function, and hormone levels. They need to pop the hood and find out exactly what's going wrong so they can build the right solution for you. And treating it successfully means going after the root cause. It's about targeted lifestyle and medical interventions. We're talking better blood sugar control, weight management, quitting smoking, getting better sleep, and wrangling that blood pressure. Once you fix that baseline foundation, then doctors can look at tailored ED medications. But you absolutely have to fix the foundation first. So let's quickly put all the puzzle pieces together. Step 1. Diabetes damages the blood vessels. Step 2. It damages the nerves. Step 3. Associated metabolic and hormonal problems pop up. Step 4. All these physical factors crash together to cause erectile dysfunction. And finally, step 5. That physical failure takes a massive toll on your confidence, your relationships, and your overall quality of life. Which leads to this absolutely critical philosophy in modern medicine. Treat the man, not just the erection. If you just ask for a magic pill without addressing the diabetes and your degrading vascular health, you're ignoring a massive, life-altering problem. You have to treat the whole system. So, I want to leave you with this final provocative thought. Is it time to finally pay attention to what your body is trying to tell you, to know your numbers, and take back your overall health? Please don't wait until the problem gets worse. Better sexual health starts with better systemic health. Let this be the exact motivation you need to go check your numbers, understand the root cause, and completely reclaim your holistic health.